Welcome to Health Politics with Dr. Mike McGee, a weekly program exploring important trends in health.
Imagine a health system in which you're required to own health insurance, just as auto drivers must have auto insurance. Imagine further a system in which the government then takes steps to make sure affordable insurance is available to you, including passing a law that requires the largest employers do their part of shouldering the burden. Now, imagine Democrats and Republicans working together to make such a plan a reality. Impossible, you say? Apparently not in Massachusetts, which in a remarkable case of bipartisan cooperation recently enacted for its citizens the nation's first universal health care program. Whether the Massachusetts plan will really work remains to be seen, but something big is going on there and we should all pay attention. It could be that what Massachusetts did is the first sign that our national problem with the uninsured, 45 million of them at last count, is finally reaching a tipping point. First, the facts. There are approximately 550,000 uninsured citizens in Massachusetts, which is 8.6% of their statewide 6.4 million citizens. The state's focus on its uninsured was sharpened by a looming federal deadline of July 2006 to show progress in addressing the uninsured or risk losing $385 million in funding for Medicaid. Under the new plan, the state will apply $125 million in additional funding to $875 million in redirected federal dollars. This funding would support a series of initiatives that directly attack the issue from multiple directions, including expanded insurance subsidies, new tax incentives, and expanded eligibility to existing insurance for at-risk populations. Specifically, all employers with more than 10 employees must provide health insurance as a benefit or pay the state $295 per employee each year. Providing such coverage will be enabled by creating large insurance pools for small business owners, driving down the cost of premiums and allowing individuals to utilize pre-tax dollars for health expenses. The uninsured must all have health insurance, as auto drivers must have auto insurance if the state deems that affordable insurance exists and is accessible for that individual. Citizens who do not purchase insurance in the first year lose their $150 state income tax personal deduction. If unresolved in a second year, they must pay the state 50% of what their premiums would have cost, which best estimates say could be as much as $1,200. Everyone's at risk. Everyone's responsible, which is the way the middle ground was struck on this effort. The concepts bubbled up from a populist coalition of advocates and religious leaders who collected 112,000 petition signatures and threatened a ballot measure if action was not taken. That created a pincer movement with federal pressure from above and citizen pressure from below. Should the plan work, an additional 215,000 would purchase private insurance. 207,000 would access subsidized coverage through new state programs, and 92,500 would be embraced within the expanded eligibility boundaries for low-income residents. Approximately 35,000 would remain uninsured. That all sounds pretty good, but does Massachusetts represent a tipping point for the rest of us? To answer that question, we need to go back a few years. In a widely publicized put-down of the exalted United States healthcare system in 2000, the World Health Organization announced its studied opinion that the U.S. global ranking was a dismal 37th. Now, putting aside the vigorous debate that followed, all agreed that of the 5 areas quantified that contributed to the overall score, the U.S. did just fine in technical competence and modern therapies, but that access and equitable and affordable distribution of care are severely flawed in America. This, of course, was no great surprise in a country with some 45 million uninsured citizens, roughly 15.6% of our entire population, not counting some 7 to 11 million illegal immigrants. Still, it represented the first global public pronouncement that something was inherently wrong with our healthcare system. Since the WHO report, the numbers have only gotten worse. There are now at least as many underinsured as there are uninsured in our country. 46% of personal bankruptcies are directly related to illness and medical debts. And the new high-deductible health plans that so many employers now offer significantly shift the financial burden of the insurance pool to the shoulders of low-income employees who are least able to afford the cost. All of this has fundamentally undermined the original proposition that insurance spreads risk across a diverse population. What we have been slowly realizing, and what Massachusetts has acknowledged, is that the only way to bring true health equity and justice is to move beyond the status quo, which relies on intervention over prevention and an outdated financing model. A few megatrends have helped speed that message forward. As retiring baby boomers put pressure on the healthcare system, empowered health consumers demand change, and the internet continues to bridge divides. Add the aggressive entrance of the technology and financial industries into the healthcare space, and suddenly the dynamics of the debate have shifted toward change and action. You can sometimes tell a tipping point by the strange bedfellows it produces. Witness the unusual alignment of Republican Governor Mitt Romney and Democratic elder statesman Senator Ted Kennedy in building the Massachusetts plan. Of the process, Kennedy said, quotes, "It was a very good relationship I had with Governor Romney from the beginning on this issue. He was very forthcoming." To which Romney responds, "There really wasn't Republican or Democrat in this. People ask me, is this conservative or liberal? And my answer is yes. It's liberal in the sense that we're getting our citizens health insurance. It's conservative in that we're not getting a government takeover." The Massachusetts plan is not perfect by any means. First, citizens are required to purchase insurance only if it's affordable, and the legislature has yet to define the meaning of affordable. Second, the plan relies on economic incentives to draw the insurance companies in to create the new plans. It remains to be seen whether the economics are sufficient to support the creation of this new market. Third, some experts question whether the program is adequately funded as proposed. One estimate places annual cost at $700 million per year. Time will tell whether these obstacles can be addressed and whether the plan will work. What we do know is that conversion from intervention to prevention is the only sensible way to manage the financial burden of health in the United States. And this requires, among other things, universal coverage. Massachusetts may not have the best answer to get us there, but it does offer hope that we might move our healthcare system from 37th to number 1. For Health Politics, I'm Mike McGee.
Thank you for watching Health Politics with Dr. Mike McGee. If you are accessing Health Politics with a portable device, please visit our homepage, healthpolitics.com, for more information on this topic and many others. If you are watching Health Politics on the Internet, please visit the links below for additional information. Download the transcript and slides to share with friends or colleagues, or use the discussion guide to help generate conversations in the classroom. If you are not yet a Health Politics subscriber and would like to begin receiving a weekly email to keep you up to date on our latest programs, please click on Subscribe to Health Politics above and enter your email address. Again, thank you for watching Health Politics with Dr. Mike McGee.